Today, Andy's come in for some hip pain that he's developed with squatting during CrossFit sort of workouts. So what we've done is we've gone through and had a look at Andy's squat and noticed he's got quite a significant butt wink. So each time he comes down and squats, the angle of his pelvis has to change due to the tightness through his hip. And that over time has developed sort of more pressure through the front here, and he's starting to develop pain as a result of that. So we did a bit more further testing. We can actually see that his sort of more resistant and stuck there. And what normal for Andy would be is if that thigh sort of hit his ribs here. So if we have a look at his other side, we can see that he's got that full flexion through there and no pain. Whereas I'm assuming there was pain on that other side. Yeah. So we'll have a look, check his internal rotation. It's like non-existent, which is not good and really sort of the byproduct of like an ongoing hip impingement type thing. So today, because we know his hip flexion is quite reduced, we're going to focus on changing the mechanics of the hip flexion and then treating the muscles in the front of his hip to decrease his pain as well. And we're going to do that using active release technique and dry needling. So the first one we're going to treat is actually the adductor magnus muscle, which is a big one on the inside of his thigh. So it's pretty much all this here. That one plays a huge role if it's tight in restricting the sort of range of hip flexion. And you can see here on Andy's face that it's tight. He's not enjoying that at all. So the adductor magnus gets really tight with people who do a lot of squatting, especially if you're starting to push and doing heavy squats, because in the bottom position, when you come up out of the squat, normally you predominantly use your glute max to drive out of the hole, but when people need a bit more force, they'll recruit the adductor magnus. And that's when you see, like, even for people with really good technique, a little bit of their knees dropping in because they're recruiting this muscle here to help the glute max. You do that over a long period of time, you develop the tightness, and we start to see a restriction in hip flexion, which can then lead to hip impingement, pain in the front of the hip, or even low back pain and disc injury if it sort of goes on for too long. So the active release technique is really good for this because what we're doing is we're stretching the muscle at the same time as working into the fascia and releasing that to restore that range of motion. We'll just do one more pass there and then retest that range, see how that looks. Good. Massive difference. That's a lot better. And that's really just the first muscle that we've worked on. So the other one that sort of will affect the range of motion in hip flexion, now that we've seen that, is we'll get up high into that junction of the hamstrings too. So Andy, let's get you laying on your side facing that way. Sort of work into that. So relaxing there. I'm going to move your leg for you. So here I'm sort of just similar spot where I'm coming around to that adductor magnus up near the hamstring tendon, hooking in there. It's tight. And we'll take that up through the hamstrings range of motion. Good. How's this one feel compared to the adductor?
Both are sore, but both feel good.
Yeah, good. You can feel that's increasing range with each sort of pass there as well. Good. Great. So now that we've sort of released the muscles that are reducing his hip range of motion, the next step is to sort of treat the ones that are creating all the pain and inflammation. So we might get you laying on your back again, Andy. So the next muscle that we want to hit is the rectus femoris. So this is part of your quads, but the only one that actually crosses the hip. So its tendon sort of runs up through here, and with that reduced hip flexion, it pinches, gets irritated, inflames, causes pain. So to treat it, we're going to get you to sit up, Andy, shuffle across towards me, and I'm going to sort of hook on to the tendon. It's a little bit junked up. Then you're going to bend that leg, grab your ankle, pull it right up, and then lay back down. You good? That's freaking tight. Come back, we'll do that a couple more times. Straighten the leg. Yep. So, yep. I think you've been needing this for a little while. That's so chunked up in there. Good. Coming back. Straight leg. Let's go again. And have you had to reduce squatting at all as a result of this?
Yeah.
A little bit?
Yeah.
Good. Okay, excellent. Let's get you now laying on your side. We've got to hit the hip flexor next. Everyone loves this one. So you're going to leave that hand over the top of your head. That'll stay there. Your leg, you're going to go straight and then taking it backwards all the way as I work into that muscle, all right? So just relax that there. Oh yeah. Straighten the leg and take it backwards all the way. Nice. Come back up. Yep, let's go. Good. Yep. One more through that muscle. Awesome. All right, onto your back again. I've got one more muscle that I want to treat in the front of the hip, and this is a small muscle which helps the adductors a little bit, called the Pectineus. So to do this one, we sink in on that muscle, drop the hip out to the side, let that go, and then we rotate. And that sucks. Okay. Yep. And rotate. Just got two more passes on that one, okay? There. Good. All right, now we've sort of treated all the inflamed tissues through the hip. We've increased the mobility, but I want to do a little bit more on that adductor magnus because I really think that's the primary issue causing all of this dysfunction. So we're going to do some needling with that next. All right, so the first one we're going to do up high in this adductor magnus, can be a little bit more sensitive. Great. And we're just going to work down that muscle. How's that feeling, Andy?
Yeah, first time's achy, but
yeah,
good.
Not the end of the world.
Nah.
What's worse, my thumbs or these needles?
I reckon your thumbs.
Yeah, they look pretty rough. All right, one more in the adductor. Oh, little twitch there. And then I think we'll go one up higher in that rectus femoris tendon so we can decrease that pain around the hip a little bit more. Just here. Yeah, that was a real good one. So we'll let them just sit for 5 minutes now. So we'll remove these now. Now guys, if you've enjoyed this video and sort of want to see how we sort of treat this, but more from a perspective if you're going low back pain, I've treated another CrossFit athlete, Riley. I'm going to link that video for you guys to watch next, but I'll see you next time.